as the federal cabinet is holding a two-day retreat here in Ottawa, plotting its fall agenda and its response to COVID-19. Minister of Intergovernmental Affairs Dominic LeBlanc is part of those discussions, and he joins us now. Hi, Minister LeBlanc. Good to see you as always.
Thanks, Vashi. Thanks for having me on your program.
Minister, I know during this retreat you're hearing from a number of medical experts. Canadians are standing by today and watching the numbers increase of COVID cases in many spots across this country. Are you, as a government, as a cabinet, convinced that a second wave is imminent?
Vashi, we're very much convinced that COVID-19 is still here. It's still showing some worrisome trends across the country. Premiers have talked about it. Public health officers across the country have talked about it. The cabinet spent a great deal of time this morning hearing from public health experts, but also from scientists at the forefront of work on vaccines, on immunization, on research around different antiviral drugs that may help treat people with COVID. So a great deal of the day has been spent on looking at what we need to do to continue to protect Canadians in the best way we can, but also understanding the economic consequences of COVID and what it means for millions of Canadians. So it's an ongoing discussion, and we've taken note of what a number of premiers have said in recent days and the uptick in numbers of cases in some parts of the country. So we'll continue to watch closely those numbers and work with public health authorities to do what's necessary.
So it's here, Minister, it's worrisome, but your government is not yet willing to declare anything a second wave.
But those decisions and those terms should probably be used by scientists. What we're saying is that COVID-19 is clearly still amongst us. It's still present. It still is a huge source of concern for Canadians and for our government. And that's why we're going to work with provinces and territories, public health authorities, to do what's necessary to protect Canadians. We've said from the beginning that is the only priority that should override everything else, is protecting Canadians. That's what we're going to continue to do. But we also have to understand the economic consequences of COVID have been extremely difficult. And there again, we have to turn our attention to do what's necessary to protect people too.
My next guest, Dr. David Naylor, I know presented to Cabinet today, and he is particularly seized with the ability, at least it's my understanding, to be able to test Canadians outside of the sort of traditional ways of diagnostic testing. So I'm speaking specifically of saliva tests, for example, that could particularly be aimed at communities like younger people who are gathering in private places, things like that we are seeing the virus really sort of migrate through. Is the federal government prepared to commit any funds to that kind of endeavor? Is your government going to make that kind of saliva testing available more widely to Canadians?
So you're absolutely right, Vashi. Dr. Naylor talked to the Cabinet about that today. Obviously, the decision to make available different kind of tests have to be based on scientific evidence around the efficiency, the reliability of these tests. So those are decisions properly made by Dr. Naylor and other distinguished scientists across the country who are offering that advice. We've already put billions of dollars in the hands of provinces to massively increase testing capacity and contact tracing, essential elements to contain the spread of COVID. But if provinces say to us that there are very promising scientific steps that can be taken to further expand testing capacity, obviously we would be very interested in those conversations. But testing and contact tracing is a critical piece of public health. We've said that from the beginning. Scientists repeated that to us again today. So our job is to work with provinces and territories and public health authorities to make sure they have all the tools necessary in the toolkit. And if those kind of rapid tests are reliable, Vashi, obviously the government would do what's necessary to ensure that they can be widely distributed as well.
You talked about the billions of dollars for provinces that your government has made available. I'm guessing, and correct me if I'm wrong, you're referring to the $19 billion as sort of a safe restart package. I think between $10 and $11 billion of that is geared towards healthcare more specifically. Has all that money flowed? Have the transfers been made?
The Prime Minister will have more to say about that in the coming days. I was on a call with the Prime Minister and all the First Ministers last week. We're very close to finalizing, if we haven't already finalized today. I've been in the meetings all day. The final elements of that money will be available. I had a conversation with Premier Horgan last week, at the end of last week, about the importance of that money reaching jurisdictions like his in British Columbia as quickly as possible. So that money will be available literally in the coming days. Those final pieces of paper are being exchanged. But provinces know they can count on that money. They helped us develop the plan together around what is a safe restart and what additional measures are required, as you said, around testing and contact tracing. So provinces have been able to rely on those funds to make investment decisions in their own jurisdictions. And we'll continue to work with them. And if more needs to be done, Vashi, we'll do more.
Okay, I have two questions based on that. I just want to be clear. The money will be there soon, but none of it has flowed yet.
Again, the Prime Minister is finalizing, as I said, with First Ministers, the final details. That money will be available literally in the coming days, and we'll have more to say about it this week. Provinces know that they can count on that money. We work collaboratively with them. My colleague Chrystia Freeland, when she was Intergovernmental Affairs Minister, and the Prime Minister worked to ensure a very, frankly, coherent and thoughtful package of elements that we could work on with the provinces. So they've known what those elements are. There have been detailed discussions with the provinces, and they've been able to count on that money to make the investments they need, for example, including a safe restart of schools.
Respectfully, when it comes to, and you mentioned if there is a need for more, that the federal government will still be there. So specifically with the potential for, and I'll just term it, I'm not a scientist either, but the possibility, let's say, of a second wave or a continued increase in what we're seeing right now, this concerning trend we're seeing right now. If the $19 billion doesn't cut it, if the healthcare needs are greater, is your government prepared to give provinces more money?
Well, we're always prepared, Vashi, to sit down with provinces and territories and look at what are, and healthcare, you've identified obviously the most important concern that Canadians have in terms of governments having the healthcare tools necessary to protect them during this pandemic, to look after those that may be affected by COVID-19. So if provinces come to us and say, look, we really could do a great deal more, but this is the particular need, of course we'll have those conversations. This isn't over, and the government hasn't finished helping Canadians, and provinces and territories in turn helping Canadians do what's necessary. So the premiers text me, they text the Prime Minister. There's an ongoing conversation, and by no means have we said that we're uninterested in doing more if more can be helpful to protect Canadians.
On that note, Minister, last week the Prime Minister, I know, agreed to a conversation with the premiers at some point in the future around the possibility, or their desire, I should say, to see the Canada Health Transfer increase. Has a date been set for that conversation?
No, it hasn't been set in terms of a precise date, Vashi, but you're right. In the call between the First Ministers last week, the premiers again raised that. The Prime Minister had committed some weeks ago to having a conversation this fall around the Canada Health Transfer. Premier Pallister spoke to me about it when I was in Winnipeg 2 weeks ago, as did Premier Kenney. All the premiers with whom I've spoken have raised that, but it's been an ongoing conversation. So we're committed to having that discussion and having it this fall. My understanding is a final date hasn't been determined, but we're working actively with provincial governments to determine the best date to, in fact, have that discussion.
Okay, before I let you go, Minister, a question on the broader agenda and the possibility of your government and the possibility of an election. I read in the Huffington Post today that, and I believe the Prime Minister was asked, that your government has not reached out to the opposition parties in the crafting of that throne speech. Is that because you want an election?
Not at all, Vashi. The Prime Minister has been clear. I've been clear. My colleagues have been clear. The government in no way thinks it would be appropriate to have an election in the context of a pandemic. Canadians expect governments to work collaboratively with opposition parties in the House of Commons, with provinces and territories. That's something that we're committed to doing. I'm very confident in the throne speech, Vashi, that the opposition parties will see many elements with which they agree. We hope they're not irresponsible enough to force an election. We would welcome their suggestions. My colleague, the House Leader, Minister Rodriguez, is in constant discussion with his counterparts. So it's an ongoing conversation, but it would be very erroneous to say in any way we're looking to trigger an election. In fact, the opposite is true.
If it's so irresponsible, Minister, of the opposition to try and force an election, why not bring them into the discussion to ensure that that doesn't happen with the throne speech?
Well, Vashti, I have no reason to think that the final draft of the throne speech has been printed.
But the Prime Minister was clear today. He wasn't going to reach out to them.
Well, it's an ongoing conversation, Vashti, that we have. I've spoke to opposition critics. As I say, the House Leader has an active and ongoing conversation. The Finance Minister clearly will be talking to her counterparts in the opposition in terms of shadow ministers or critics. So there's an ongoing conversation. But we also know, because we read carefully what the opposition says, they have a number of priorities that they said the government should focus on, and it won't be a surprise to them that we hope a great number of the priorities they've been articulating over the last number of months are also shared by the government and will find their way into the throne speech. So it will be an inclusive, collaborative document, in no way designed to push everybody to the brink of an election. That would be very irresponsible in our view. Okay, Minister, I'll leave it there. I'm out of time. Thank you very much for your time, as always. Thanks, Vashti. Thanks for having me on the program. Thank you. Hi, I'm Vashti Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.